now until it's perfect and just go okay, or I'll go
Okay.
okay.
Good.
And I'm gonna make sure that everybody, okay. So,
Where did you go?
I wanna see if I can get you, I have to view you here.
And when I went back, they numbed it and fixed it. They made an error.
Do I see everybody? Now I just wanna see two
So
people.
then, so now I have to go back to my desk.
And I,
This is a very unique situation. She has audio on her iPad, she has the camera on her laptop. This is from her laptop. I want her screen, she's zooming in, she's the host now. I wanna see her on here. And, yes, but I don't mind, you know, Carol, the one that we see, that one right there, it has to go on here. We wanna see everything, and we're not the host anymore. Oh, look at that.
what are you seeing? You seeing something good?
Guy's amazing. Taught him everything he knows. He's a genius. Okay. Good. So we see you, and we see the presentation here, and you see the people. And the people on Zoom see what I see, which is good. You have to put your focus on the PowerPoint one more time and just advance the slide once. Just click somewhere on the screen to make sure it advances when you want it to advance.
It's not.
Just click on it, click on the elephant,
Oh, okay.
and then hit the arrow. There you go. Perfect. Okay, so now what I'll do is you're recording already, which is fantastic.
Correct.
And I think that we're after one, so we're gonna kick it off.
Okay.
And I'll just introduce you to the group, to everybody. Matter of fact, I'll go over here so everybody hears us. Hello, how are you? Welcome all personal participants in-house and also Zoomers. I'm John Klimzak, I'm the Hydrant Program Administrator. We are pleased to have Carol Moore Penfield here, a nurse practitioner, and she's going to share valuable insights on balance. So,
Yeah.
Without any further ado, here's Carol.
Great. Hi, everybody. I hope you're February so far, nice and chilly over there. And I thought it's always a good time to talk about our balance when we're in the middle of winter months, because that's fall prevention is key, but also understanding why our balance is off, or are there ways that we can manage our balance better so that we do not fall. So this is, I can never express enough how important fall prevention is. And I think as we age more and more, we appreciate that more and more as we have friends or family that have a fall and they tend to not recover. After age 65, we don't tend to recover quite as well. So it's very important that we address our balance in all the ways that we can understand. Did I hear something?
Yes, we changed the speaker for us.
Okay. Now I have an echo.
You have an echo?
Yeah. Test, not now. All right. So we'll continue on. We'll continue on talking about our balance. So this is an interesting statistic, 1 of 3, but more recently 1 of 4. So that's kind of a changing statistic, but 1 out of 4 people over age 65 will fall every year. So there's enough people in that senior center room right now to say, uh-oh, who's it gonna be? So it's very important that we do all that we can to prevent falls. So when we look at all the side effects, shall we say, of falls, first is your disability. So you break something or you strain something, and it takes a lot longer for us to heal than it ever did when we were 20 or 30 years old. So any sort of fallback, no pun intended, of our health really affects our mobilization, affects a lot of components of our life. So we start to have our dependences affected. We have to become more dependent on others or dependent on assistive devices. And this often will breed fear and saying, oh gosh, I don't dare go out, it's raining, or it's too snowy, or it's icy. And those are all really legitimate reasons. But it does become quite isolating for people when they are fearful of falling. We want to respect the risk of fall, but when we get so fearful, then it can turn into isolation, which can lead towards depression. So it's a component of adding to depression that happens to people over age 65 anyway, but adding on your fall risks can increase that. And most importantly, a percentage of people who fall over age 65 will die within that year of a broken hip, if they've had a broken hip, is the statistic out there. So it's really serious stuff. So we're here to talk about balance, because if we have good enough balance, then hopefully we won't fall. So let's talk a little more about what affects our balance. There's really three components that affect your balance. We have medical conditions, we have mechanical conditions, and then we have environmental conditions. So all three of those have to be addressed or assessed to look at which one of these is affecting my balance. Don't you love that gal there on her head? That's Sarah Oaten, actually. She's a world-known rower, and she succeeded in rowing across 2 or 3 oceans, believe it or not, and she circumnavigated almost the whole world. She was on her last leg when I met her in Chatham. That's the Chatham Beach there, where she was to row across the Atlantic to her home in England, and unfortunately hit a big storm. Anyway, she has pretty good balance there, which probably has helped with all that time in the water. When your body and your core is always adjusting to that movement, you get quite strong and able to hold yourself in space, which we're going to talk about a little bit more. So let's touch upon medical conditions first. So I think you probably all have heard in the past about inner ear issues, where you have some inner ear changes of the cochlea, the semicircular canal, and I'll spare you all those fancy terms. But in brief understanding, in the inner ear, there's a little bit of fluid in there. And that fluid, with that movement of the fluid, tells your body what needs to happen to accommodate that fluid. The best example I can come up with, maybe for the gentlemen watching, or actually some of us women, may know what a level is. You know, when you have that long ruler that has the little bubble in the fluid, that if you move that level a certain way, all of a sudden that bubble's in the center and everything is parallel. Well, when that fluid's moving in our ear, the body's getting the same feedback of where am I in space, and am I level with the horizon, so to speak. So the inner ear, and it's such a small area that little changes can happen so easily in that area to really affect our balance. Secondly is diabetes. So as we know, diabetes is a high uncontrolled sugar. Actually, we're talking about diabetes next month. And when diabetes gets out of hand and that extra sugar in the body, it also affects the blood vessels, it affects the nerves and the sensations in the body. And those sensations are what will affect our balance. Thirdly is neuropathy, and neuropathy is a change in nerve impulses, or malfunctioning of the nerve, and diabetes is the #1 cause of that. So say there's numbness, or there's tingling, or there's heat or pain sensations in your feet. You may not be standing on your feet quite correctly, and that will give you feedback that may affect your balance. So having shoes on, wearing shoes all the time that are proper fitting, now that shoe can give pressure against the foot and hopefully give a sensation back to the brain, telling you how your balance is and how you're level footed. So neuropathy affecting the nerves won't be able to communicate to the brain as well to tell you where you are in space and how to move, and communicating back down again. Fourthly is visual changes, and this is such an easy one to manage. Now maybe we have poor near sight or poor far sight, where we're wearing bifocals. And next thing you know, you go to look down and your glasses aren't on, and now you're blurry vision, not seeing where your feet are, or you look up ahead of you and don't realize that the steps, there's an extra step there that you've missed going down or going up. So your eyeglasses are extremely important for managing the feedback. So that feedback from those eyes will talk to the brain, and the brain will tell you how to manage your balance. For example, if you're to stand there and all of a sudden close your eyes, people start to sway a little bit. Reason being is those eyes are giving you feedback of where you are in space, which we'll talk about a little bit more as well. Circulatory disorders. So if there's poor circulation to the vessels, poor circulation to the nerves, such as the neuropathy, it'll give the feedback that I told you about that might alter your balance. But also like having peripheral vascular disease. So you get swelling in your feet or swelling in your ankles. Now you're trying to move these heavier legs that don't feel like your normal feet. And that can affect your balance quite a bit. Parkinson's and multiple sclerosis, those are a little more obvious medical conditions that would affect the balance. Parkinson's with that leaning forward, kind of shuffled gait, inability to initiate the move when your brain wants to make it happen, but the body can't quite catch up. Multiple sclerosis is weakness, which weakness plays a huge role in your balance as well. Infection. So certainly a sinus infection. Maybe someone's had in the past a sinus infection. You said, gee, I got a little dizzy and just kind of a little bit woozy, or inner ear infection. And again, will affect those the circular canals of the brain, the inner ear. And so that infection will affect, again, your balance and will cause some dizziness. And lastly is medications. So if you're taking sleeping pills, even some blood pressure pills that slow your heart rate, slow your response to your motor skills, anti-seizure medicines, antipsychotic medications also kind of make people a little woozy, maybe a little dizzy, and a little slowed, so that we're not able to quickly respond to a change in the environment that may cause an effect to our balance and cause us to fall. So those are medical conditions. Mechanical conditions. Weakness, number one, and we're going to talk a little bit more near the end about ways to keep you strong. So if you don't have the muscles able to hold you up, then you will collapse down. So right now I'm sitting at the edge of my chair, and my core muscles, abdominal muscles, my back muscles, my shoulder muscles, they're all holding me in and back and stable. Now, if they weren't strong enough, then I would not be able to hold myself in the position to keep my balance. And we have a 15-degree leeway before we fall. So we want those muscles to contract, pull you back up to where you need to be so that you don't fall. So weakness is critical for improving your, affecting your balance. Stroke, that's another obvious mechanical change where you might have weakness on one side of the body, needing a cane or visual changes, or the arm isn't, it has weakness, so you're all of a sudden you're asymmetric, and managing asymmetry all the time puts you much higher risk for altered balance and falls. Arthritis of weight-bearing joints. Boy, if we could just walk on our hands, we'd all feel a lot better. So ankles, knees, hips, those are all weight-bearing joints. And there's weight-bearing in your back even. That can affect your gait. So if you're limping because of a knee replacement or a hip replacement, or even just from arthritic pain, but also with those replacements, sometimes there's nerve changes, because they're going in there surgically, and they may affect some of those nerves along the way. And now there's a little numbness in that area, which causes you not to have the typical sensations you have and need to sustain your balance. So arthritis and on weight-bearing joints is, and I already mentioned backs, but really back pain. So if you have pain in the back and you're curved forward a little bit. Now your movement through space is different than your body's used to. You're used to standing up like so, and that's how you're really able to manage your balance. But now all of a sudden you're in a forward position, accommodating backs. And same with pregnancy, opposite. Now all of a sudden there's a big belly out in front of you, and your gait and your balance is going to be off. But I think all of us are not at risk for pregnancy in this class today. So we get a free pass on that one. All right, and then the third component that's affecting your balance is environmental. So poorly lit areas, again, I had mentioned earlier how eyesight is so important in telling you where you are in space, that if it's poorly lit, you won't get that feedback. And so definitely night lights in the bathrooms or in the hallways, or just leaving on a light in the evenings, just so that you have good, well-lit areas that will help you negotiate any uneven surfaces like stairs or where rugs are, etc. Wet floors, that pretty much goes without saying. If you find yourself in a position of being in a rainy situation or an icy situation, really making sure that your stance is wide. So if you're usually standing here with your feet this far apart, take it wider and kind of waddle through the situation. Hey, it doesn't matter what you look like. You look much better upright than you would if you fall. So it's worth changing that gait into a wider stance if you need to with wet floors. Uneven surfaces, that also is a classic situation where all of a sudden you miss. I was just talking to somebody yesterday who tore his whole quadricep because he missed the last step of the stairs. So he's a young guy and still had a big tear and took a long time to recover from. So taking the time, if you're on a cobblestone street or a brick walkway or where there's stairs, really concentrating on those uneven surfaces so that you're managing this with your full awareness. Loose rugs, very common situation. Some of the edges start to peel up. You kind of catch your feet on them. You can also catch your feet on really thick rugs too. So you want to make sure that you're able to lift and clear your foot. So that's an example of having strength and flexibility to lift and clear your foot when you're walking, to clear these loose rugs and be able to step up over them. And then of course, that's why my last dog, Charlie, there is sitting there, because he can tug you when you wanted to, for whatever reason, chasing a squirrel or something. And even though he's small, he can really jostle me up. So you know, definitely a dog or a pet on a leash, hopefully they're smaller, like less than 20 pounds, or less likely going to jolt you too much. But then just kind of running in front of you or getting underfoot or surprising you, unfortunately, they challenge your balance. But they're such love bugs, so you got to put up with it. Okay. So we'll just touch upon fall prevention a little bit more, and then I want to get into balance, which is what we're still talking about as well, but you can't talk about balance without fall prevention. So we already mentioned about handling those throw rugs, extension cords, uneven surfaces, so anything underfoot. So we start to walk, with our head down now, making sure that our feet are safe and careful, and you got to make sure you know what's going on in front of you. So now if you're looking in front of you, but your eyesight isn't as good as it used to be, and you can't have your peripheral vision, you need to take things a little slower. Okay, let me look down. Okay, everything in front of me looks okay. I'm going to go back up to my normal posture, walk to the area that I know is okay, and then assess again. So when you think about we're driving a car, we sort of do that. We sort of watch the road just in front of you. You make sure you kind of scan and make sure things in front of you and behind you are okay. But the focus is really where your next step is going to be, or your next, 30 or 40 feet. Safety first. Hold on to grab rails. And I should put this in bright red, not people. What happens often is people will pull and grab for help, and that person now is vulnerable, you're vulnerable, and both of you can go down quite easily. I also have seen a lot of people, you know, taking someone's hand and leading them with their hand. That makes the shoulder very vulnerable. So you want to, if you are going to take someone's arm, you want to have hand to wrist, hand to elbow, or wrist to hand, to make sure that you've got a good solid hold with each other. But whenever you can, a grab rail is ideal. Or someone navigating with their own cane or their walker. People are always want to help you, and probably you want to help other people as well. But that's a time to just say, okay, look, I'm going to let you manage with your walker and your cane. Just be careful of that next step, or take one step and then let's just wait, or watch out for that piece of, you know, you can coach a little bit. But when you start to move them, you're moving them the way you feel you should be moving them. They're not necessarily moving the way they're comfortable. And that's a high risk for a fall. Proper lighting, especially in the bathrooms. I love the automatic lighting when you're entering into homes. Those are great so that you don't have to fumble around in the dark and try to find light switches. Very helpful. Concentrate. So my mother-in-law had a big challenge with her balance in the last few years of her life, went through a lot of physical therapy working on balance. And one of the first and foremost important things that the PT taught her was, do not multitask while you're walking. Talking or looking at something, or hey, look at that bird, or you're on the phone, or you're carrying something. The minute you put anything with your walking, it puts you much higher risk of fall, because what happens is you're not concentrating on your balance. So back to our topic, which is our balance. So distractions greatly affect your balance. So making sure that you, when you get up from a chair, count to 10 so your circulation can recover, and then go ahead and walk. Carrying items in light bags or just in one hand so that you can hold on to a railing in the other hand. All of those are important to just take the time, because I think if any of you have fallen in the past, usually the backstory is I was rushing, I wasn't paying attention, I had to go to the bathroom, the phone was ringing, I didn't look at the ground in front of me. You know, one of those sorts of things. All of this list, it's usually something from this list. So concentration and good footwear, which I touched upon a little earlier. So if you don't have great sensation in your feet because of neuropathy or because of circulatory changes, then having a proper snug shoe can give you also feedback, proprioception, telling you where you are in space. I feel pressure against the bottom of my foot. My feet are stable on that first step. My foot isn't tilted off of that curb. So the footwear will give you that feedback, along with your properly fitting glasses and updated glasses. So, of course, we're going to talk today about strength, flexibility, and balance exercises, because you're all here about your balance. So your balance isn't going to get necessarily any better with us sitting in our chairs. So that's the one feedback over time, is that our bodies don't get as much sensation or as much challenge in its balance, and your balance just sitting here all day long. So we're not playing hopscotch like we did when we were little kids, or playing sports, or just running free, or being on 1 foot and 2 feet and climbing up and swinging in a swing and climbing trees or what have you. We spend a lot more time in our cars, in our chairs, and in our bed. So we have to really break that up often by giving ourselves challenges. So right now, we can all say, okay, wait a minute, I'm leaning back in the chair. Let's all sit up in our chair without leaning back. So sitting up with your feet out in front of you, and spend a little time here without necessarily leaning back in the chair. So right now my muscles aren't working. My core muscles don't have to work. So they aren't being exercised during the day. So all of a sudden asking them to work when you're walking and moving, they may not be as in good a shape. Okay, and so now I chose this topic because it's February on Cape Cod, and so winter is plays a big role here. And a couple of things. One biggie is stairs, icy stairs coming in and out of your house. I can't express enough how important it is to turn sideways on your stair. So you're going to face the banister, and then you can go up the stairs if things look really slippery or scary to you or ill lit. Or you can go down the stairs one at a time. And you can choose the leg that does better. So if you say there's one leg weaker than the other, then you want to use your strong leg going up and your weaker leg going down. So up, you think of heaven and hell, up with the good, down with the bad. So as you're going up with your good leg, all your body weight now has to be lifted up. But when you're going down on your weaker leg, you're able to have your body over it. And as you slowly lower down, the other leg can show up and help out. So up with the good, up with your good leg if you're going upstairs, down with your bad leg first, or your weaker leg. I don't ever like using the term bad, good and bad legs. You have great legs. We all have two, thank goodness. So the weaker leg would be going down first. So that's the sidestepping on stairways, especially in the winter. I love the trekking poles. Those are poles that retract in and are small, so you can carry them with you and take places, and then they retract, and then they expand out so that they're trekking poles. And you want those trekking poles to be fairly high, at least 90-degree angle here of your arms, so that when you're walking, you now have 4 legs. And that's great for if you're going to places where you don't have anywhere to hold on to. So you're bringing along your own grab rails. Love trekking poles. You can have them with spikes at the bottom, so for ice or for the sand, or they can have a rubber bottom for just walking, say, in the mall or in a doctor's office or out on the streets that go walking to your mailbox or something. The other I'm a big fan of is clamp-ons. And what those are kind of like rubber galoshes, but they're just straps. And on the bottom, there's little spikes. So it goes on your shoe. And now you have little metal spikes underneath your shoe that you've clamped on. And you can just put them over at your winter boot or your sneaker for days that are icy and dangerous. And snowshoes, I used snowshoes a lot in the winter time right on the beach. Even if there wasn't a whole bunch of snow, and I was hoping for more snow, that it just gave a nice big wide platform for me to walk and get really good exercise, strengthening my legs. And they now make them so they're not big and long and bulky, but they're really quite small and manageable. And it's a great way to get your exercise in, you're walking in the winter months if there's a little bit of snow or ice there, because they also have kind of the metal little teeth underneath that kind of grip and hold you in place. All right, so now that we've gone through all that, let's look a little bit more into the orientation and the effects of our balance. So just bring my screen over a little bit here for a moment. So the components, so in the corners, you see orientation, direction, muscle control, and balance. So first, this top left corner, orientation. So that's sort of, where are you? Okay, I am in the senior center. I am seated in a chair, and it's daytime and light out. Next over is direction. I'm, facing forward. I'm facing towards the screen. I'm lined up well in my chair. Your muscle control, bottom left. Are you still sitting up without any support to the back? Or are we leaning back? Your feet may be on the floor. There might be some sensation there. Balance, not doing too much balance right now, but you haven't fallen over in your chair. So there is a very low baseline of managing your balance in a seated position rather than just standing. So your body's position in relationship to its surroundings is what's managing our balance. So where we are in relationship to everything around us. So now let's look at the center of this slide. and looking at the different ways that you can gauge your own balance ability. And this is a Berg balance scale. So this is some assessments that are typically used in the PT setting. And you also can self-evaluate yourself. Since I'm not with you today, it's a little hard for us to do this too much. But the first one, the blue lady, how quickly and comfortably can you raise out of a chair? Do you need to use your hands to get up and down out of the chair? So your ability to get up and out of a chair is one thing that measures your strength, but to get up out of your chair and then walk is when more components of your neuromuscular system get involved. So you can say, okay, can I do 12 sit stands, get up and down out of my chair 12 times in 30 seconds? That's something you can quiz yourself on when you get home. So hands across the chest. How many times can you sit and stand out of a chair? And you can time yourself. The goal is 12 in 30 seconds, 12 in 30 seconds. So that's a good measurement of strength and also endurance as well. So secondly, we have the orange man. So are you steady when standing with your feet close together? So if our feet are tight together, that's enough to make things a little tougher. You can challenge your balance by pretending you're standing on a balance beam. We call that tandem foot, one foot in front of the other, so toe to heel. Can you stand there? If the arms go out, that means you're using extra assistance here, like the tightroper going across the buildings in New York. Your hands are out like so, then that's helping you with your balance, just like a plane has its wings. It kind of gives you just a little bit of lift. But can you do this without the hands out, with the hands down by your sides or at your waist? One foot in front of the other. See how long you can stand like that? Then try it with the other foot in front. So this is a way to assess your balance, because we often have a default way of holding ourselves. If I said, okay, everybody stand up and put one foot in front of the other, probably most of you would be put your right foot out in front. But some people say, well, no, actually I have a right knee replacement. I would probably put my left foot in front first. So making sure that you do the same exercise with the other foot in front, because you will pick the dominant, more strong leg to do the work each time with some of these exercises. So you want to make sure that you put yourself in the alternative, with the other foot involved in front. And so that brings you just a little further with feet together and then tandem feet. And then, as I mentioned, your best defense is having a wide stance when you're in a icy situation. So the third one here, we got the green lady. How quickly do you begin to fall when nudged? Well, we don't need to necessarily do that one, but you could come up and just have someone just, push you on the shoulder, push you to the side. And are you able to go to that 15 degrees and come back up? Are you able to go back and come back up? Now you'll see if all of a sudden I got pushed back, now you see how flexibility is important. If I have a stiff back, I'm going to fall. But if I have some fluid motion to my body, the ability to accommodate what just happened, which takes flexibility, then you're more likely going to not fall. So that's where flexibility plays a huge role in your balance. So if you're finding that you're stiffer as we get older, that's also leading towards affecting your balance. And then third is, how steady are you when turning 130 degrees? So often we'll be okay for a little bit standing, but if you all of a sudden look right and all of a sudden look left, there's that visual change. That's enough to make some people get off balance. To be able to circle all the way around, that also can affect your balance because your visual field is changing. That's why those ballerinas and those professional dancers always turn and spot, turn and spot, turn and spot, finding that one focal point that they're returning to so that their visual field remains constant. So when you're practicing your balance, look at something not moving. and concentrate on standing on one leg or on the other leg or doing whatever your balance exercise is, plays a big role. So these are ways that you can assess your own balance or your risk for decreased balance. So these all are areas to evaluate. Now, of course, it wouldn't be a lecture without some sort of exercise in here. So remember, my specialty is lifestyle medicine. So looking at how we live our life day to day through our movement, through our nutrition, through our sleep, etc. So here we are with movement. This is strengthening. So let's look at the top left corner, the wall slide with a ball. Now you can also do that. I think it's, yeah, you can see me here. When I can just put my back against the wall, walk my feet away and slide on down and just sit there, pretend I have an imaginary chair. You don't necessarily need the ball to do it, but it's hard to go up and down because it's a sticky wall, but you can just go down and hold as long as you can. Now, while you're here, you might say, oh, I'm standing on my right leg a little more because I had a surgery on my left leg. Let me concentrate and make sure both legs are equally working on this wall slide. So that's another way to assess your balance, is looking at, do I have one leg weaker than the other from some sort of a musculoskeletal issue in the past. Even with that wall slide, you can shift your weight and say, okay, I'm going to stand as much as I can just on one leg for a while. Does that feel strong? And now I'll try to stand a little more on the other leg for a while. Does it feel just as strong as the other? So you can assess yourself on your leg strength with that exercise. And you just hold as long as you can. Secondly, is that exercise in the middle here. This is a foot exercise. Now, you know, we got a lot of ligaments in our feet, not a whole bunch of muscles, and it's really a little tricky to keep that ankle strong, because certainly we can easily twist an ankle and break a foot or break an ankle or twist off of a curb and what have you. So these muscles that make your foot go tilt in and tilt out are great little muscles to strengthen. So here you're sitting there with the elastic around your foot, and you can hold it out with the hand at one side, or it could be a loop around the other foot. And then that foot, so see how the instep turns in, and then the instep goes away out to the right. So the instep turns in towards the left, and then the instep goes out towards the right. That's your right foot, as you would see it if you're sitting with your leg in front. Also, that leg is out on a surface so that nothing else can move anywhere. So you're just strictly working on the ankle. That is great for not twisting ankles and preventing foot fractures. All right, now we've got the gal over there in the red shirt. This is an easy one for all of you to do at home, which is called the step up. Now, the thing about the step up is to make sure that you're doing it at the bottom step, so that you don't fall, since we're talking about fall prevention as well. Now you could bring your foot up just one step. She's bringing it up 2 steps, which can be done, but I recommend just going with 1 step, which tends to be, I think it's 8 inches. And your leg is at a 90-degree angle. And so you're standing at the bottom step, you put 1 foot on that step, and you come up to it and come back down, up to it and come back down, up to it. I call it repeaters. Now you want to try to be pushing off that top leg. So up on that leg, rather than pushing off the floor. Okay, so that top leg is doing all the work. After you do 10 to 15, you switch, the other leg is up, come up onto it and down, up onto it and down, up onto it and down. So fit that into your day anytime. If you have stairs going up in your house and during a commercial on TV, you can just do 15 each leg and do it 3 times during the day. You don't have any stairs in your house, but you're coming in from your car and there's a step up from your garage into your kitchen, then just stop there for a moment and say, I'm going to do 15 of these. Up, down, up, down, up, down, other leg, up, down, up, down, up, down. Now I'm going to go inside. And so you can sneak that into your day quite easily. And it's a really effective way of keeping your legs strong, evaluating right leg and left leg strength. Okay. So here's a very busy slide, but this is all more related to balance. The last page was on strength. So let's start again in the top left corner. So we have the lady with her hands across her chest and she's standing on one foot. So if you're going to try doing that, you want to have a surface area in front of you so that you have a place to balance, and then you can lift that leg up and work on your balance. Now, if you say, gee, I can lift my leg up and things are going pretty well, you can add a little movement to it. You can try the leg back behind you and lift it up behind you or out to the side for a while and kind of mix up where that leg is so that you're challenging your body three-dimensionally. Life isn't always a leg out in front of you and just staring at one thing. Life will be three-dimensional, going left, going right, going back, going forward, going up, going down, rotating. So the goal on one leg stands is, in the older population, will take 10 to 12 seconds on one leg. But if you can get to 20 seconds, then you're much lower risk of falls. So the goal is 20 seconds held on one while you're standing on one leg. So you can go home and try that out. Say, can I get to 20 seconds? If not, the foot comes down, then you just keep practicing and say, okay, now I can get to 10 seconds. Now I can get this to 11 seconds. Now I can get it to 15. And keep working on that. So what's happening is those muscles, those small muscles of the foot and ankle, are contracting and releasing, holding that leg in space, and so that it doesn't give way and cause you to fall. And also, that's when your ankles are, if they're weak, you may kind of fold out to the side. So standing on one leg at a time and then moving that leg to add challenge. Okay, so, the center picture here is for your calf strength, because your calves are working also to hold your feet in position and hold the rest of your body working up the kinetic chain in right position. So can you come up onto your toes? Do you have the strength to be able to come up onto the toes? Do you have the strength to be able to rock back on your heels and lift your toes and hold that position? That's probably one of the most challenging positions to hold, is those toes up and your back on your heels. But if somebody pushes you this way, that's a time you're going to want to be able to balance on those heels and come back up. So up on the toes, back on the heels, up on the toes, back on the heels, practicing that. Then we look over at the man in gray, and he is practicing tandem stepping. So that's walking the tightrope, toe to heel, and focusing on something not moving in front of you. He has his hands up to help him with balance. As you get better at it, your hands will be down by your side if you can, but have something nearby as you're practicing that. So again, that's the sensation of the foot and the ankle working to give communication and biofeedback back up to the brain, your central nervous system, to tell your muscles what to do and sensory nerves what to do. Toe heel walking. So now we're coming down over to the bottom left, the box step. So that is step together, back together, left together, front together, side together, back together, out. I remember my dad teaching me that box step, teaching me how to slow dance with my husband. So that practices shifting your weight from right foot to left foot. So if you're evaluating your balance, figuring out how your balance is, do you find it that you're able to step over onto one foot and sustain your balance better, or over onto the right foot and sustain your balance better? Also, it practices stepping back. Sometimes when you're on a roadway and there's a car coming, you got to step back up onto the sidewalk. You want to be able to have your balance there. Your eyesight's not going to help you then, because you're seeing out here, but your body has to go back here. So the box step helps with that part of your balance. The sit stand, we already talked about quite extensively with the wall slide, but this is another way of doing the same exercise. And as we said, your goal is to try to be able to do 12 and 30 seconds. The most advanced is the next one over, the gal in the black with the red ball. And that is a modified version of that would be you're standing and first with both legs and just practice touching the chair with your right hand or your left hand. And then try to go on to one foot and try to touch and come back up, touch and come back up. So that's practicing how to multitask when you're on one foot or the other. So when we think about our balance, we're not, okay, on my screen, I got two screens on here. When we think about our balance, we're not kangaroos jumping on 2 feet or birds hopping up and flying, but we get on one foot and then we lift the other leg up. We're standing only on one foot for a brief second before the other foot comes down. We're standing on that foot for a brief second before the other leg comes down. So we want to be able to master managing our body and our balance while we're on one foot at a time. And that's an exaggerated example of that to help work those small little muscles of the feet and ankles and help you with your focus, but all leading towards, do I feel stable and secure when I'm on one foot or on the other foot? And then lastly, we have the clock, where in this case, he's got his right leg going to tap out in front, side. So noon, 1, 3, 4, 5, 6 come together. Noon, 11, 10, 9, 8, 7, 6 come together. So you can either go front and around, or you can start in the back, 6, 7, 8, 9, 10, and coming back in front. So that also helps work on your balance, like the box step. It's helping practice when your foot has to go behind you and now your vision can't help you as much. So practicing the taps behind, being able to sustain your weight, sustain your balance while that leg is behind you. That is a key component to that exercise. So those are all great. And remember, you can get this PowerPoint anytime from the folks at the COA. All right, just when you thought you had enough exercise information here, here's a few more. So core and stabilization. So a lot of times when people are trying to figure out, why is my balance not good? Why can't I hold myself up very well? Well, we also have this frame called our core, our abdominals and our back muscles and our stabilizing muscles of our core that help hold us in place. So if I'm sitting here in the chair, my legs aren't doing anything, but someone could push me and I could still fall overboard, so I'm on a boat. I could still fall off the chair if someone pushed me hard enough, because that's my core muscles holding me where I am. Also, if you think about it like a bicycle, it's a lot easier to ride a bicycle that has a nice straight frame and the wheels can move nice and smoothly, as opposed to a bent frame or an uneven frame, and now the wheels are kind of jostling, erratically and not in a good linear pattern. So your core, how you hold your body in space, it plays a big role in your balance. The earlier examples was the pregnant person who's leaning back, or the back pain person who is leaning forward, or the hip replacement person who's leaning to one side, or the knee replacement person who always has a slight bend in the knee. Now they're walking unevenly. All of these things play a role, and your core is still there to try to hold it all together, even with their uneven body parts going on between the legs or the knees or the hips. So here are some core exercises. So the top left, we'll start again with the gal seated. She and the gal in the center top are doing the same exercise. Opposite elbow coming down to the opposite knee and back up. Elbow to knee and back up. Elbow to knee and back up. So that's working abdominals, reaching those arms back up, his shoulder strength, and your back has to work, and preferably not leaning back in the chair. So let's check in. Is everybody still leaning back in their chairs? Or are we still sitting up and using our core and getting stronger? So over time, we kind of forget about those things and we get into a relaxed, comfortable position. So these exercises can be done right in the chair, or they can be done standing. The gal all the way over to the right in the black, where she has a chair and she's pulling one knee into the chest, and then the other, and coming back out with that foot and bringing the other knee in. That will work your abdominal region, your lower abs, without you having to go and do crunching sit-ups and all that crazy stuff. You don't have to get on the floor. You don't have to get on a mat. You don't have to do anything down there. These are all exercises that will help strengthen your back and your abdominals by just staying up in an upright position. So she's holding on to that chair, single knee in, bring it back out, single knee in, bring it back out. And you can hold it for a period of time to work those abs. Then we have the bottom two, which are the same move, but they are in either standing or in all fours. That's probably my most favorite back exercise of all time. Some of you have been listening to me for a few years, know this already. But that's called the bird dog, when you have opposite arm and leg reaching in opposite directions. Now the body has to work to hold you equal on both sides to accommodate the opposite arm and leg. So those are great exercises. You hold on, you can hold on to a chair. That man standing can have a chair in front of him. Opposite arm and leg, hold 5 seconds. Opposite arm and leg, hold 5 seconds, do about 10 times. So that's my core and stabilization. And then lastly, of course, you all get to see my mother there on the right. This is a little while ago. I think she's 85 maybe, or 86, winning a blue ribbon in her ballroom dancing with Adam from Chatham. And she had never, up to this point, she has never fallen. And she is a Tai Chi instructor, as you see on the left. Tai Chi has been scientifically proven to help decrease your risk for falls and to improve your balance. So anytime you can attend a Tai Chi class or do it at home, you certainly should. There's different types. But you'll kind of see an example that this is a sequence of slow movements in the martial art category, where you're shifting your weight from right foot to left foot, maybe a little forward, maybe a little back, maybe the arms move a little bit, and then they come on back. But it's slow, it's methodical, and it increases your awareness of your balance. And so anytime you're doing something to help improve your awareness of your surroundings, where your body is in space, that will help promote and improve your balance and decrease your risk for falls. Well, I think I've talked enough. So if anybody wants to ask any questions, I am all ears. I got 2 screens, so I'm trying to see what I see here. If anybody has, lots of people at home. I'm glad you all made it. Some of new names, new folks that I've seen. So I'm Carol Penfield, to anybody here who doesn't know me. I'm a nurse practitioner. I've been for a long time, and I specialize in lifestyle medicine. You can also, if you don't feel comfortable asking questions during these seminars, you're always welcome to email me at Carol M. Penfield. So my name, Carol Penfield with a middle initial M at gmail.com. So there's always that option. And I know that this lecture is available also at the COA. So any questions? Everybody's still sitting up at the edge of their seats with their core working, chin in and shoulders back, and good posture, which also plays a role in our balance. Yes, of course. Janet, great. Hello, Janet. If you want to unmute yourself, feel free to ask.
I'm not asking. I want to thank you so much for such an excellent, helpful presentation. I have had 2 knee replacements, and I have been going to Spalding for exercises. And several of the exercises you showed are things I'm already doing, but there are others also. So as usual, your presentation is so good and so helpful. Thank you.
You're very welcome, Janet. Great. And I'm glad that you're in good hands with PT, because it is very, very important to have PT after any sort of surgeries or medical conditions, because they just help guide you through getting moving again and in a safe way. So I'm really glad that you're doing all that. It's important. They are very helpful. Good. Yeah, PT also has they do balance and fall prevention, so you can literally get referred by your physician or provider for physical therapy for balance and fall prevention if you've had falls in the past. So that will be covered by insurance. Yeah. Well, thank you, Janet. Anybody else? All right. So next month, so I always do my talks on Tuesdays at 1 o'clock. The last Tuesday, the fourth Tuesday of the month. And I believe it's diabetes, on blood sugar management and diabetes. And if you know anybody that has diabetes, please come, even if you don't. Because what's interesting about diabetes is we all just thought it was all about not eating carbohydrates and not eating sugar, but it's actually more to it now. And actually my dietary recommendations are very different than that. So, and even if you don't have diabetes, you can prevent it. And the easiest way to prevent it is to not gain weight. So we will talk about weight management and its role with preventing diabetes as well. So if there's no more questions, you can always reach me by email, or you can ask one now.
Thank you, Carol.
Oh, you're welcome, Adele. Thanks everybody for coming, and I will see you in a month.
Bye.
Bye-bye.
How old is your mother-in-law? Oh, Lord, much